You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell. Today's talk is called The Miraculous Treatment You've Never Heard of. Now, I'm sure some of you have heard of this treatment actually, but probably a lot have not. So today I would like to discuss a very important treatment for autoimmune disorders and pain. It may be the best treatment you've never heard of. Low-dose naltrexone has been used for decades and yet still remains an outcast in the treatment options that doctors currently use. What is naltrexone? Well, this is a drug. It was originally introduced to treat drug addicts and alcoholics. Its action is to block endorphins. What are endorphins? They are happy hormones, natural to the human body. They are produced from exercise, laughter, a hug, dark chocolate, and generally anything that makes you happy can be mediated by endorphins. In drug addiction, the endorphins are part of the response driving addicts to their addictions, be it drugs or alcohol. A product was introduced for this purpose. It was a 50 milligram dose of naltrexone. Naltrexone inhibits the endorphins, and this was enough to inhibit it for 24 hours of the day. Therefore, drug addicts and alcoholics could not get high from the substances they're addicted to. This discourages the use because they're not getting anything from their drugs. And it was to break the chains that draw folks to use and abuse. Some doctors, in musing about endorphins and the relationship between naltrexone, wondered if they could be increased for other patients. Endorphins are not only happy hormones, but they decrease inflammation, depression, and can decrease pain and antibody overproduction. It was shown that tiny doses of naltrexone could be used to suppress endorphins for a small amount of time, usually about 4 hours. During this time, the body tries to push through the suppression by increasing stimulation to produce the endorphins. Thus, when 4 hours is over, the endorphin suppression is gone, and the underlying attempt to increase endorphins wins out, and they increase. This therapy is really important in autoimmune disorders, pain syndrome, and gut inflammation, because those endorphins help with calming inflammation, stopping antibody production, and modulating pain. A true miracle story is a patient who had multiple sclerosis. Unfortunately, this woman was confined to a wheelchair, experiencing all the difficulties one can have with this disease. She was introduced to LDN, low-dose naltrexone. It worked miracles for her. She was so impressed with the reversal of symptoms she had. She started an organization to spread the word. For those folks who would like to see more information, Linda Ellsworth's LDN Research Trust has been providing information including research and seminars with physician specialists who are using this with excellent results. Her website is www.ldnresearchtrust.org. Check it out. It's full of information. The last time I saw Linda, who was coordinating seminars, information, books, and so on about this miracle drug, she was running down the aisles, getting this done and that set up. She's bubbly and a wonderful person to deal with and talk to. Thank you, Linda, for all the work you've done in providing information on this therapy. That's it for today. Thanks for listening.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.